Good morning.
Yeah, that's me.
I'll get the leader to turn her speakers off. Thank you, leader. Right, good morning. Welcome to this meeting of the Health and Wellbeing Board. I'm Councillor Graham Bridgen and I chair board. As we know, this meeting is being held in a hybrid format, so we have a rather large number of members for a change in the room, and I welcome everyone physically into Market Street. It's good to see you, and a number of other members and others attending remotely via Zoom, so we're hybrid. So we clearly have a quorum of board members in the room, and because things have somewhat changed since the chairman's briefing note I received, I'm actually going to sort of look around the room to see who's here. So we have, in no desperate order, Paul Coe, Councillor Rick Jones, Steve Welch, Councillor Martha Vickers, Councillor Joe Stewart, Councillor Lynn Doherty, myself, Graham Bridgman, and then going this way, Belinda Sestons, Heike Veltman, Dr. Heike Veltman, Councillor Steve Masters, and welcome Andrew Sharp. We have other board members joining us virtually, and I've got a list of those who are on Zoom, so I'm just going to quickly whip down and see who's here. So these are, some are members and some are here for various items on the agenda. There is a list of members available on one of the agenda items if anyone wants to see who's who. Adrian Barker's here, welcome. I hope I don't miss anyone. Gail Muirhead, Zakia Acha, Gary Paulson, Professor Tracy Daskovitz appears to be here twice, so one of those names got to be wrong. Robert Bowen, Sean Murphy. I'm just going to see if I can work out who the who the other Tracy Daskovitz. You've obviously shared your link, Tracy. We have met, and I can't remember who you are. Would you like to just unmute quickly and say hello?
Good morning. I'm Dan Devitt. I'm the Senior Public Health Strategist for the Berkshire West system. Apologies for the duplication.
Well, there's a little button you can press and you can change your name, so feel free to do that.
Thank you.
Excellent. Well done. Someone's done it for you. Okay. We're being live streamed, as always, via YouTube. And I have with me Gordon Oliver, who is clerking the meeting, and Jack Karimi, who is playing the part of the Zoom host. Now, technically, only those board members and their substitutes who are physically in the chamber can actually vote properly on any of the items, but as necessary, I will take an indicative vote of all of the members. And I would remind everyone that there is a list of members at agenda item 7. So if you are actually a member or a substitute for a member, you are entitled to vote. And I encourage you to do so, because we have occasions when people are a little uncertain as to whether they vote or not. Right, so before we get into this, it being a Thursday and it being Market Street, there is a planned test of both the fire alarm and the lockdown alarm at 10 o'clock. So if you discover that we were talking in the chamber and suddenly switch our mics off and stop talking, that's what's going on. Right, so item 1 on our agenda is apologies for absence. And I will say, members, that we have a pretty packed agenda. So I'd be grateful if we can try to rattle through to the extent we can, obviously giving everything the attention it deserves. So apologies for absence. Gordon, have we had apologies?
Yes, we have. We've had apologies from Councillor Dominic Bowick and Councillor Rick Jones as substituting, from Matt Hensby, from Dr. Janet Lippett, William Orr, Andy Sharp and Paul Coe as substituting, from Sarah Webster, Belinda Seston substituting, and from Jessica Jundu Evans.
Thank you. We now turn to the minutes of the previous meeting. I wasn't there, and I'm thanking Belinda for chairing the meeting in my absence. Very well done. Members, is there anything you want to raise as a matter? Councillor Vickers. Would you like to use your mic, Councillor Vickers?
Sorry, I couldn't get my virtual hand to go up, so I've just stuck my hand up. Just on page 17, on the Health and Wellbeing Forward Plan, it says that the Health Watch report on asylum seekers will be brought to this meeting. Obviously, this is quite an urgent matter, and I'd just like clarification of why that's not here, please.
Principally because well, I'll let Andrew talk to it if he wishes to, but it was pretty late in coming before us, so therefore it's got to go through it needs to go to locality integration board first, so it's going to go there, then it's going to go to the steering group, and then it will come here. So Andrew, do you want to make comment?
Thank you, Mr. Chair. I think this is one of those strange positions where both people are right. Which always complicates matters, because one of the key things with the reporting that we produce and the work we produce is that we're independent. We have got into a model where we like to give providers the opportunity to respond, to see things rather than just publishing, because honestly, it's just more helpful. However, we don't have to. And I think I share some of Councillor Vickers' concerns that the urgency possibly should have outweighed the procedure. And we have a meeting with our partners in the voluntary sector and our board to sort of decide the next steps, because the report actually talked about almost instantaneous action in some cases, because obviously there's long-term things that cannot just appear or be changed. But I think with the pressures on local services, and I'm thinking especially the medical services, which we all know are under such huge pressure to then have a new cohort of very complex patients just dumped on you, which is effectively what's happened. And I think also, you know, there's other things going on both locally and nationally that are of great concern. So the board would sort of like the Health and Wellbeing Board to sort of consider some of the shorter term actions to see whether anything can be done before this formally comes back to the board in February, because we sort of believe that that's a little bit late for some of the actions. So that's our position. So we haven't made a final decision on publication date or ever. We're still talking to the various providers and obviously Health and Wellbeing by yourself. So we're trying not to be sensationalist in any way. That is not going to help anyone. We actually just want to improve how the system reacts, how it reacts to short-term issues and short-term problems, and recognise that a lot of the people caught up in this will end up staying in the UK because they'll get leave to remain, and it's whether it's appropriate to treat people as their introduction to the country in that kind of manner where they aren't necessarily receiving things like the right amount of food or appropriate food for their medical conditions. So it's a tricky one, I'm afraid. Thank you.
Indeed. And I think from my point of view also, and I have seen the draft report, there are elements in it where I think West Berkshire wishes to ensure that at least Health Watch is aware of possible concerns about some of the wording, some of the language before it come. Now, Health Watch are perfectly entitled to ignore that. But I think it's helpful to have that dialogue before publication, so that if Health Watch do take on board anything that West Berkshire in particular say, it just smooths that process. Andrew.
What would be super helpful is if we can get back any specifics, because you know clearly we're not a large organisation, and sometimes it's very challenging to put difficult subjects in appropriate language without failing to explain what you're actually trying to say, but equally not, as you said, using language which might cause issues in itself. So if we could get any sort of steer into particular bits, I think we're more than happy to consider appropriate changes, because as I said, I think if that's the real key, then I think what we've got to try and get to as quickly as we can is the meat of the problems and the issues we've raised, because we think it can be sorted. We think the statutory partners in here will want to do that, and I think we could end up with an exemplar reaction to this problem, which is affecting everyone across the country. And I think West Berkshire should strive to do that if they can. Thank you.
Yeah, I think I'm looking at Paul. Lib is next week. So, you know, things are moving forward, and we'll be discussing it. Okay, and thank you for that. Anything else anyone wants to raise in respect to the minutes? Okay, even though I wasn't there and I won't actually vote on them, I will propose them nevertheless. Does that find a seconder? Councillor Stewart, thank you. Those who wish to say yay to the minutes, please raise your physical. I'm not going to go to a virtual vote on this one. Physical hand in the room. You've got that going. Yeah, and abstentions. And I'm guessing there are no votes against. Thank you all. Okay, let's move on. So next we have the actions arising from the meeting and generally. I'm going to read out, I'm always given very helpful notes by Gordon here. So I'm going to read out my notes, and then if anyone else wants to come in on any of the items or come back on any of the items I've read out, please do. So action 153, timing of that peer review is going to take account of timescales for place-based partnerships coming in. So we're going to try and tie the two together. Steve Welch nods. Thank you, Steve, because he's going to be leading on that one. Action 197. And I'm just rushing to get my physical document in front of me so I can see what we're talking about. Unified Executive, yes, well, this is going to go through the place-based partnership for obvious reasons. 205, I'm going to look if I'm hoping he's in the room, to Sean. I saw his name earlier. There you are, Sean. Sean, can you just give us a quick comment on this one?
Just trying to, I'm just looking for it, Chair. Can you just...
Swans and water safety, you lucky man.
Well, I mean, I can't actually recall whether the issue was actually discussed at the Water Safety Partnership about swans in Newbury. I don't think it was actually, but I will check that, Chair, and come back to you on that.
Thank you. And 208, we've got a reference on this later on in the agenda. So we will be looking at the question of the conference. So does anyone have anything to raise on any of the items that are on the forward plan? Matters arising. Okay, no, good. We move on then. So next we have public questions. Now, members of the public can submit questions to the board, and we have received 2 questions, both from Mr. Stuart Gourlay, and they are in the pack. However, I understand that Mr. Gourlay is unable to attend the meeting either physically or by Zoom. So what will happen is that those questions will be answered in writing, and the written answers will be supplied, and obviously they'll also be published. Next item on the agenda is petitions. Gordon, have we had any petitions?
No petitions received, Chairman.
Thank you. Right, so we now move on to Health and Wellbeing Board membership. You have a table of membership at item 7, and let's reflect what has happened. So with the advent of the Integrated Care Board and it's taking over from the Clinical Commissioning Group, obviously there was then a change in process. So Sarah Webster has come in to the board and is replacing Belinda as a formal core member. And we've got representatives there, so we've got substitutes there for both, jointly for Sarah and Heike, as Belinda and Helen Clark and Joe Reeves, all of whom I have to say are superb subs. So we've got a very good selection of subs there. And William Orr is going to deputise for Dr. Janet Lippett while she's acting as chief exec of Royal Berks, because of course there has been movement in, people have moved from the Royal Berks up to the ICB, and so on and so forth. And Rachel Peters is going to be sub for Gary Paulson, and that's very helpful to have Gary have a sub. So, Councillor Masters.
Thank you, Chairman. I just want to raise the point that this meeting is Andrew Sharp's final meeting before he leaves.
You can be assured I was coming to that.
All right, yeah, I just wanted to suggest that the board extend their thanks.
And the next thing in my note, and it was even if it hadn't been in my note, it would have been in my note if I put it that way, is that this is the last meeting for Andrew. It's also, by the way, the last meeting for Dr. Zakia Acha, who's also leaving us. So I want to thank both of them, but I think it would be remiss of me not to thank Andrew in particular for sterling service that he's given through Healthwatch, both to the generality of West Berkshire, but to the board from our particular point of view. So thank you, Andrew. Thank you, Zakia.
Thank you.
Any issues on the membership? As usual, I encourage anyone who hasn't got a sub to appoint one or more of them. Always useful if you can't turn up, but you've got someone who can turn up on your behalf. Okay, we get on to the meat of the meeting and we start with the Bob ICB and ICS update. And I'm going to ask, and I'm hoping he's, yes, I can see he's in the room, Rob Bowen to talk to this item. Rob.
Morning, everybody. Thank you very much for inviting me to come along. Tracy, did you want to say a few words of introduction as to what the strategy is, and then I can run through the presentation?
I'd be happy to, Rob. Thank you.
Great.
Good morning, everyone, and thank you, Chair, for the introduction to the item. You'll all be aware that this has been a few weeks in the development. We've been working really closely across local authorities and the ICB to develop the strategy. We've had the good fortune of having local authority colleagues lead on a number and facilitate a number of the chapters. I myself have done health protection, but we've also had Dan Devitt working on it in Ingwood, who's the lead consultant in Wokingham. So good representation from public health, and there's also been a number of public health colleagues on the workshops. The way the chapters have been developed have been through multi-agency workshops of experts around those areas, so that we could work to the prioritisation within those work streams. And then, as you all know, Councillor Bridgman, that has then come to the founder members group for ratification and discussion. So we are in a good place to share a draft strategy, and obviously look forward to the discussion this morning. Thanks, Rob.
Brilliant. Thank you, Tracy. What I was proposing to do is just to very, very quickly go through the slides that have been circulated with a view of doing two things. One is just having a look back to explain what we've done and how we've got to where we are at the moment. And then what I'm keen to do is just to explain what we're planning to do over the next couple of months, and ideally have a bit of a discussion about the best way for us to get the best possible input that we can from West Berkshire and residents in West Berkshire. So if I can sort of break it into those two different bits, that would be helpful. I will try and share my screen. Is that the most constructive thing to do, or would?
Give it a whirl, go on.
I can't. Host has disabled participant screen sharing.
Someone they're rushing to their keypad.
I can talk through it without the slides if people have got them and can refer to them separately. Shall I try again? Here we go. Can people see that?
Not yet. Gordon's got his finger to his mouth, which is always a bad sign.
Hold on.
Excellent.
That's working?
Up and running.
Good. Okay. So these are the slides that were circulated in the papers. I'm going to run through them, just make a couple of points quickly, but happy to take questions as we go through. firstly, just to reiterate what Tracy said, massive thanks to a number of people from West Berkshire, particularly who've been involved in this process, and from Berkshire West more generally. The input that we've had, it's been great. The point of putting this slide in is really just to reiterate that as we're talking this through, even though I come from the Integrated Care Board and I am an NHS employee, what we are presenting here has been developed on behalf of the Integrated Care Partnership. So this is something that we are presenting as something that should be representative of all of the different players and partners in that ICP group. So this is something that is being developed on behalf of the system, not just on behalf of the ICB or on behalf of the NHS. Just to again reiterate what the integrated care strategy is for. So the integrated care strategy is something that is required in statute to be produced by the Integrated Care Partnership, and the purpose for that is to make sure that the Integrated Care Partnership is setting a direction of travel for the system that all of the partners are then ideally signed up to support, and it sets a clear direction for different organisations to be responding to in the longer term. It is very deliberately, in terms of what it is, it's something that should be setting out to improve the public's health and well-being. It's about tackling health inequalities. Ideally, we're looking across the system and identifying where we can share best practice and learning and innovations that we are aware of across the system, and where it's necessary, thinking about how we can benefit from scale to solve some of the problems that that we might need to tackle as a system. More importantly, I'm keen just to dwell on how, and particularly the first bullet of this. It's really important that we are clear that this strategy is not meant to in any way replace or supersede local health and well-being strategies and other organizational strategies. This is meant to be something that is supposed to complement and support what is already in place locally. So if it feels in any way like we are, the work that's being presented is unraveling or undoing anything that's in the health and well-being strategies, we've done something wrong. I'll explain a little bit about how we've developed it as we come through, but it's really important that this is seen as something that is building on what's happening locally and some of the commitments that we've got locally. In terms of how we've done it as well, Tracy mentioned that we've tried to be as inclusive as we can be in terms of the people that have been involved in some of the discussion groups. That's thinking about which geographies they come from, which organizations they come from, what their professional backgrounds are, so that we're really trying to get that inclusive perspective as we're developing some of those, some of the priorities. I think you will probably have seen these groups presented to you before, but these were the thematic areas that were taken forward to work up some of the priorities and to agree what those priorities were for the system. You'll see that we've got a mixture of different sort of professional backgrounds represented in the people that were leading those discussions and trying to coordinate those discussions. And what we've tried to do there is to build on some of the thematic areas that were common across the different health and wellbeing strategies that we looked at for the whole of the Bob area. I'm going to keep going through quickly. In terms of where we've got to now, so we have got to a point where a number of priorities have been suggested and developed and worked up, and those are sitting under a a vision of what it is that we aim to achieve. And this is a vision that has been discussed with Health and Wellbeing Board chairs. It's been discussed with some of the local authority and ICB members that sit as part of the Integrated Care Partnership. So hopefully they are reflective of things that you want for your populations. But the vision is about trying to ensure that our populations have the best possible start for life and to live the happier, healthier lives for longer and have access to the right support when you need it. There are the 5 principles that we've got here that are really important principles that will flow through all of the different priorities, and we'll see that in a bit more detail when you get the full document. But really taking forward and trying to promote the ideas of kind of keeping people well, of identifying and tackling the inequalities, of being person-centered in how we're thinking about designing and delivering the support for our populations, making sure that we are continuing to think about place and what we're doing locally as a priority principle for how we're delivering, and then joining up where we think there's benefit of joining up. I'm not going to talk through these principles in detail. I'm happy to take questions, as I'm sure Tracy will be, on how we've got to where some of these are. And I think let's stop there, and then kind of the second bit about looking forward, I think we'll come back to, if that's okay.
Yeah, happy with that, because and thank you for that, because you'll be aware we are under some time pressure. And yep. I will simply comment, firstly, that so far as this area is concerned, I'm double-hatted, because I am both in the Chair Health and Wellbeing Board's group. I'm also on the ICP as the representative member from West Berkshire Council. So I'm well into this, and in the idea of making sure that we line up the strategy at ICS level with the strategy we're going to have at place level, and then with all the actions that West Berkshire will be taking on, making sure we're doing what we need to do, place is doing what it needs to do, and system is doing what it needs to do, is going to be very important. But just as a clarity, the strategy hasn't yet been signed off by the ICP, but I don't personally see that as an issue. I think this is a good place to be, and I think it's saying the right things from my personal point of view. But I'm happy to see if any members wish to raise anything in relation to the strategy as it's coming forward. Excellent. Well done, everyone. No questions. We have got Andrew. I do apologise. I didn't see your hand. Andrew.
Thanks, Mr. Chair. Just some very, very quick points. One, I think it's very, very important that we always take the population and public with us and explain why and what we're trying to do in very simple terms and easy to understand language. Two, I'm slightly concerned in some of the priorities, the ICS possibly is overreaching its area of influence and responsibility, because so much is dependent on so many other departments outside of their control. So if we're talking about controlling obesity, drinking and things like that, most of the services that deal with that are not under their control. And I think it's inherent on like the Oscars. We'll talk through that one. Yeah. So really, it's inherent on the sort of ICS NHS not overreaching what it actually can do, and I think from a local authority point of view, absolutely ensuring that the right departments are sitting at the right tables. Because who'd have thought that planning and activities like that were directly correlated to obesity, but they are. If you fill poor areas with fast food outlets, off licenses, etc., should you be surprised when the general population's health is not perhaps what it might be? But that is clearly outside of the ICS's remit. So I think it's really incumbent on the local authorities and public health especially to make sure the right people are in the rooms. And I just wanted to briefly, because it will come up with the cost of living issue, one of the things that I've asked to be addressed, and I wonder whether the Better Care Fund is a route to this, is to ensure people who rely on public transport to go everywhere, do everything, that the risks of people not being able to get it, afford it, which then impact on their health, are actually somewhere written into this as a golden thread, because there's little point being given a prescription for medicine if you can't afford it. If you fall through the system and you don't take it, you end up being sicker and then more services being. So I think that holistic approach, and where the local authorities got some real skills to actually apply to this, I think it's really important the ICS take note of that and keep asking the public. Thank you.
Yeah, I don't disagree, and I'll let Rob come back in a moment, but clearly the whole point of this exercise is the word integrated. We have to have the right things being done at the right level. Then there's the question of where's the money coming from and how's it getting paid for. But fundamentally, we need to make sure that we are addressing the right issues at the right time. And clearly, for one thing, childhood obesity is certainly one of the things that public health within West Berkshire are to address, and public health in all the other local authorities are out there to address to the extent they can. And I take on board what you've said about obesity, but let's let Rob come back.
Thank you. Andrew, thank you for raising that point. I agree with Councillor Bridgman. I think it's very, very important that we do this in an integrated way. I'm going to be slightly pedantic about language. So you talked about the integrated care system. The integrated care system is all of the different players who are formally represented through the integrated care partnership. It's a complete jungle of integrated care this and integrated care that, and it is very confusing for us who are involved in it, let alone trying to explain it to the public. But the purpose of this document is that it is written on behalf of everybody involved in the delivery and support of people to stay well and healthy across the whole of our geography, not just the NHS. So this is not an NHS document. This is something that's written on behalf of all of the population. So the reach of this document is potentially huge, and certainly should, there is a question as to kind of how we include in it some of the stuff that we've got in there around the wider determinants, but that's definitely within the scope of the organisations who are included within the partnership. So there's a balance, I think, about what we include, how do we say that it's important, but yet recognize that this is probably something that's going to be delivered more at place, and there might be some things that will benefit at system. So there's been a balance that we've had to strike as we've been going through this, about it not saying everything, because it can't say everything, and just trying to say here are the things that we think are important that we continue to focus on across the system, but on behalf of all of the different organisations involved in keeping people well and supporting people's health and well-being. I'll stop there.
Indeed, thank you, Rob. Thank you, Rob. Is there? I mean, I'm conscious of time. We're running to time, but almost in danger of running over time. So, are you okay if we leave that item there?
Could I just say a quick thing about engagement in terms of what's happening next? So the ambition, as Andrew has pointed out, is that we want to involve as many people as we can in the development of this. We've tried to do that to date, but the intention now is that we have a period of engagement, which is going to be engagement with both the public and with partner organisations. Hopefully the full document will be available to the public from Monday. And there is a period of engagement where we've got the document available through various different fora for the public to comment on, and that will be open until the end of January. So it would be really helpful. We don't need to discuss it now, but it would be really helpful if members have got ideas about if there's anything specific that we need to do in West Berkshire that will support kind of a clear voice coming through from either West Berkshire residents or from kind of members across the West Berkshire Council, just being clear about how we can get the best input to help shape this from a West Berkshire perspective.
What I will do is ask Gordon, please, to make sure we get the linkage between you and our comms team. So we make sure.
So I think that's already happened. But Gordon, it would be helpful if we can just confirm that.
Just make sure that drives through and we get that message out. So I've got Gary and then Councillor Vickers. So Gary.
Yeah, just a quick one, Chair. Thank you. I would just say, Rob, we've obviously come through a pretty big consultation for the health and wellbeing strategy for Berkshire West, and each of the voluntary sector have played a big part in putting those strategies together. And I think it would be certainly a good call to speak with public health partners in each of the districts just to look at the consultation outcomes there, because otherwise there's going to be a bit weary responses, I suspect. Well, haven't we just done this? And they may not see the difference. They'll just see another sort of consultation with similar sorts of aims and strategies towards it. So I think there is a lot has been done.
Great. And
bearing in mind that you said you didn't want to override those strategies.
Yeah, absolutely, which we don't.
Yeah. Okay.
So thank you. Yeah.
And Councillor Vickers.
Thank you. Yes. Just on the point of how we communicate with our most vulnerable sections in the community, the sort of nitty-gritty of this. Obviously, these are the people whose health outcomes we're most concerned about, and yet they're the people that we always miss out on, really, because they're so difficult to communicate with. So obviously, I can see that, ideas for communication are being looked for. So hopefully we'll all come back with how we think people could be contacted in our own communities. I mean, they have to be sort of met with where they meet. They're possibly not going to be looking at websites, filling in forms, being active. So one needs to go to where young parents meet, where older people meet, and there's lots of places within the community, but I can see that's resource heavy, but that's what we need to do if we're going to find out how to keep our most vulnerable communities healthy.
Good, thank you.
I think truism and noted. So members, there's no vote here. It's an item to note, and I think we note it. Thank you. Right, next. Tracy, you're going to talk to Capen, the 9th item, which is the Berkshire Suicide Prevention Strategy. But just in doing that, before you do, could I just get you to say a couple of words about Strep A? Because obviously it is very much in the news at the moment. You and I have had a virtual conversation, as it were, about where we are. Certain letters have gone out, but if you just give some sit rep, if you like, for the public.
Of course, yeah, happy to. So Strep A, as Councillor Bridgman said, is obviously quite prominent in the news at the moment. So this is a bacteria. So group Streptococcus A is a common bacteria. It is something that it exists in our throat and on our skin, and we live with it quite well. It does, however, lead to certain infections and can make people poorly. And what we're seeing at the moment is an increased number of cases of scarlet fever. So this predominantly is affecting children, particularly children under the age of 10, and can make children quite poorly where they have scarlet fever. So we see this in a rise of temperature, and it often creates a flushing of the cheeks and a very particular rash. And the rash is really important because that is the thing that will distinguish it most prominently as scarlet fever. That rash is quite unique in the way it feels, and that's really important for children with darker skin because the flushing rash won't necessarily show as well. So feeling that rash and it feels a bit like sandpaper. And if you find that your child is unwell, then obviously use your judgment as parents and carers to seek the advice you need. Scarlet fever usually lasts a few days and most children will recover quite quickly from it. In most cases, antibiotics may be given. What is in the news and is taking prominence at the moment is IGAS. So this is invasive strep A. And what this can lead to is almost like a sepsis condition and can be fatal, but this is incredibly rare. Why it's getting a lot of emphasis at the moment is because scarlet fever, we're seeing this out of season. Usually it's something that we see around March, April time. So seeing it in this time of year is unusual. So it is getting an awful lot of press attention. There is a lot of misinformation out there. I'd advise people to go to your council websites or your ICB websites, where we've put a lot of consistent messaging up there, what parents can do, what they should be looking out for, so that we can get these messages in a single way and make sure people are getting the right information so people can act quickly in the best interest of their child. But like I say, strep A in itself is a very common bacteria. Scarlet fever is easily treated with antibiotics, and invasive strep A is incredibly rare. But parents, if you're worried about your children, obviously seek the advice you need.
Thank you. Very helpful, very useful. Let's move on then now to your item 9 and the suicide prevention strategy. Over to you.
Thank you, and thank you for allowing us to come back. Before I start, I will say that obviously we are talking about suicide. So if people are affected by this topic, please do make sure you have someone to speak to directly afterwards. Obviously, I'm around, but colleagues, or just make sure you have somebody to debrief on and to talk about the topic as it stands. This was brought to Health Wellbeing Board back in the summer after a review of the suicide prevention strategy that was published in October 21, which was a really broad document, took into consideration a huge amount that we needed to be focused on around suicide prevention. But shortly after it was published, there was a lot of change, not least the aftermath of COVID coming to our consciousness and thinking about the impacts of that, but also in terms of an emphasis in terms of those people that would be most at risk, understanding root causes and getting on board around real-time surveillance around suicide. So we came to Health Wellbeing Board to ask that we were able to do a refresh of that document and to reform the Suicide Prevention Partnership. That partnership has been reformed and is working incredibly hard. The group have come together incredibly well. We have a huge range of colleagues around the table that bring their expertise, and I know Gary's on the call this morning as well, who may want to talk to this item. So what we've done is done a refresh of that strategy. We've looked more closely at the data and the different data streams that are available to us, and we are doing a refresh of that strategy. The consultation for this strategy is going to launch on the 12th of December with the Suicide Prevention Summit. Health and Wellbeing Board colleagues have been invited to that. And as part of that, we will be talking through the processes we've done, looking at the data, but also hearing about people that have experienced suicide within their family and them sharing their stories around that. This is really important for us to get on top of. It's one of those topics that I think is often a side conversation around mental health, but actually it needs the prominence in its own right. It's often underreported. We hear of about 6,000 suicides a year, but when we look at inquest data and the outcomes of those, we often can see narrative outcomes being given or open verdicts given, which masks the actual number of suicides we are actually experiencing in this country. Second to that, the impact around suicide is changing and vulnerability of suicide is changing. So we will have known over the past few years very sad stories of children who have taken their own lives as a result of bullying on social media. So the whole dynamic of how people are affected and how people get to that point of despair is changing. And I think we need new awareness and new conversation around that so that we can protect the most vulnerable. Having that early data and intelligence is really important, but what is crucial is that gives us the insight in how to reduce suicide attempts and death by suicide within our communities. And some of that has been done by the multi-agency partnership that's come together. So greater understanding of where places are where people may go to take their lives, but not publicising them, and having really clear conversations about people who may be at risk. There's also emerging research coming out about this, about 15 minutes to spare. And if we can get to people within those 15 minutes of despair, we can divert them away from suicide. Having that conversation is key. And we hear this all the time about talking to somebody, making sure we ask how people are, ask how they really are, and try and understand where people are. It really, really helps. So we can't really talk about talking enough. But the suicide prevention strategy, like I say, we want to take this into a really dynamic space. We want health in all policies. We want prevention of poor health and prevention of harm in all of our policies, and suicide is the best starting place for that. I'm happy to take any questions. Like I say, the consultation will start on the 12th of December with the launch at the summit on Monday. Dan is on call, who has been instrumental in getting the refresh written. And like I say, Gary is also on the call, so I'm sure between the three of us, we can answer any questions you may have. Thanks, Chair.
Thank you for that, and thank you for. Before I come to members' questions, I'm going to ask Gary, because of his interest and involvement in this area, to say anything he wants to say, and then I'll come to questions.
Yeah, thank you. Well, obviously it's a good report. It's and I'm pleased that the Berkshire-wide group has been reformed, and it gives a refresh and a certain impetus again. I think that there's only a couple of things really. There's in 410. There's mention of our membership of NPSA, which we are, but we're not members for ourselves. We're members for the West Berkshire Suicide Prevention Action Group, of which the local authority is a member. I mean, it wouldn't do any harm for the council to join it, but it would probably end up coming back to, the messages would come back to me again in duplication. So, but there we are. But we're certainly busy there. And the only thing I also want to comment on Amparo, because and I think again it's great that we've got that commissioned. However, I do have some concerns about their capacity from some anecdotal issues going on here, and I want to talk about that because there isn't, and I'm happy to talk about that offline, but I think it's quite an important issue to deal with, some very live matters at the moment. And finally, I would just probably like to see, and I've been part of this, but we've got our meeting on Monday, of course, looking forward to the summit on Monday, but I just think I want to see something reflected in there about some practical measures as well. We talk about strategies and so forth, but actually having had quite lengthy conversations with Ross, who'd been chairing the meeting prior, then I think he acknowledged that actually what he would like to have seen is action groups like ours in each of the other districts, and I think that would actually have some real practical outcomes that we can do, and we're happy to sort of advise the way we went about that, but certainly we're working quite hard, and we've agreed as of yesterday, we're going to be delivering a training course, a different themed group of people every month from 2023. So it'll be a course every single month for people. And we're continuing to work on getting resources out to businesses, which are alluded to in this report as well. So I think this is absolutely right. I think this is on the money, this report, but I think we just should be pointing it towards either some resources for the various other parts of Berkshire, and not least in West Berkshire as well, to make sure we can continue, because we've only got our outreach worker employed until actually April. So we're going to be trying to find some money so we can continue that 1 day per week officer that we've got. But otherwise, yeah, good.
Thanks, Gary. Councillor Doherty.
Thanks, Tracy. The report, it was really useful and very interesting. There's just a couple of points. One, I'm not quite sure I got an invite to the 12th of December, and I would have really liked to come along to that because it's an area I'm particularly interested in. I work in it in my other life as well, so I'm not convinced I was invited, and I would have loved to have come along, and unfortunately I can't now. I'm saying I'm not convinced because my diary does tend to be hectic. So, but I'm not sure if members did receive that invite. So that was one thing I just wanted to highlight. The other thing was, and I think Gary, you may have just touched upon it, because while I recognise that we've got a pan-Berkshire wide response, and actually when you look at some of the numbers, it always feels funny talking about numbers when you're talking about suicide, because I'm always sensitive that they are individuals. But when you look at the numbers, they would be a reflection of the, if we take 6 unitaries, that we've got about 10 people in West Berkshire, so we wouldn't see ourselves out of kilter. But it did lead me down to the fact that we've got a post-vention service, which I think is really positive. I think that's a really positive step that we've got a post-vention service. But I wondered how many of those 10 surrounding families and friends, whatever the situation, got support from that service. And I guess that touches on Gary's point around capacity, because my thoughts were really pleased there's a service there. It's spread across Bob. Are we getting enough of that service here in West Berkshire?
Yeah, no, and I thank you, Councillor Doherty. I think you're absolutely right. And I think that's part of, because what we haven't been able to do in time of this, but it's the piece of work that will follow, will be a comprehensive needs assessment, and that will start to have those community conversations to try and understand more of that. Because one of the other things is people's pathway to mental health and crisis support, and a lot of that at the moment is picked up by the police, because a lot of it happens out of hours, and 999 is the only number you can dial. So there is a lot of conversation I think we need to understand, both in terms of people's pathway into low-level mental health support, but crisis mental health support, and also suicide prevention with these specialist groups such as Gary's. But that only will help us if we've got the capacity to meet demand. So understanding that demand is going to be absolutely crucial. So absolutely a point well made and noted as we go forward with this. Concerned that you never received the invitation. Did other members of the Health and Wellbeing Board get that? Because it should have come to all Health and Wellbeing Board members.
If I'd say I've just been looking up, I've got an email from Dan, and yes, to myself, Lynn, Councillor Doherty, and various others. But what it says is it gives details of the summit, but says a full invitation with joining instructions will follow on shortly. I think that's where it fell down. I just sort of read that, noted it, and thought, oh well, you know, there's a follow up, and of course we get.
So you haven't had placeholders in your diary.
Appreciate, and I don't think we got the invite. Now I suspect I can attend if I get the invite. Monday.
So we started at 9:30, 9:45.
On Monday.
And it runs through till mid-afternoon. Yeah.
So anyway,
I will go back to Ross and see what's happened with that then, and why those haven't gone out, because that should have been followed up a good few weeks ago.
Sorry to interject. I wonder if, because there was a date change, I wonder if that confused things a little bit as well. It was put back, wasn't it?
Yeah, it was pushed back.
Yeah.
The email is subsequent to the date change. It refers to the date change in the body of the email. So yeah, anyway, whatever. Andrew.
Thank you, Chair. Thank you, Tracy. I think it's an excellent report, and thank you, Gary, for all the brilliant work you continue to do on this. I get the feeling we talk about this when the report comes back every now and again. And I wonder whether our approach should be more a sort of golden thread, because it touches so many different areas, whether it's primary care, secondary care, crisis care, social care. And it just sort of dawned on me when we were talking about the police being almost the last sort of point of contact for most people, because lots of events happen when other services aren't available. Should we look across the system as to whether suicide perhaps needs to be a standing item on more places, or at least boards that should consider it have to discuss it at least on a particular basis, be it annual, or because the figures here will be discussed here. I don't believe they will be discussed at many significant other boards, be it local in locality integration, be it primary care. I'm sure they'll be discussed at mental health, but I wonder if that siloing of sort of saying it's a mental health issue when sometimes it's clearly a system issue. And I wonder if this golden thread approach to integration this is the prime example of where we really should be doing it. Thank you.
Well, I hear that. I don't think we're going to be able to answer that one necessarily now. So let's take that, have the conversation and see where we go to with it. So I see no, Councillor Stewart.
Sorry, just I was just trying to find it, and I think it's a good moment to mention it. So the Samaritans have recently released a new phone number, which is 116123, very similar to 999, but it is for people in a mental health crisis. It's dedicated for anyone in need of that urgent assistance. And I would recommend that everybody puts that out on social media so that it gets, and not just social media, clearly not everyone's on social media, but to remember it and let people know. So I think that's really important. Thank you.
Gary.
If people are willing, on my signature, there is a website that we created for suicide prevention, which contains the immediate and non-immediate sources of report. If people wanted to add that web link to their signatures for a bit, it would be very welcome, because it'd be a practical demonstration. It's not logoed up. It's owned by the Suicide Prevention Action Group, which is in tiny writing, but it's a very useful link. I'll pop it into the chat, and then if people want to add it to their signatures for a bit, then it might make a difference, or invite others to add it to their signatures too. Because it's about that 15 minutes that Tracy was alluding to as well. It's about getting the help in those moments, because it is a transient issue. The suicidal thoughts are transient, and if you can keep people safe for 15 minutes or 15 hours, then it'll probably go away for a bit. Yeah, so I'll do that.
Thanks, Gary. Very useful. Right, members, I think we're not asked to vote on this. We're asked to note the actions that are being taken. And I think they are noted. So we now move on to children and young people's mental health, and Leila Johnson's going to speak to this. So welcome, Leila. Over to you.
Good morning. Do you want me to share the presentation on screen? That's probably helpful, unless you've got it ready. I'll have a go.
You should be okay. There you go.
Can you see that?
Yeah, you just need to go into the slide view, the presentation view, rather than.
Okay. Is that better?
I think that's excellent. Thank you.
Right, so I'm here to present the Children and Young People's Mental Health Refreshed Local Transformation Plan that will cover this year, 2022 to 2024. So just a little bit of background. So for those of you that have been party to this before, this is an NHS England requirement that we have a local transformation plans for children and young people's mental health services. That includes both some of the NHS services, but also some of the wider services in partnership. It sets out how we will invest in resources to improve children and young people's mental health across the entire system. These plans this time round are considered to be living documents, and therefore we'd expect them to develop over time. The local area is asked to refresh and publish these plans every year. Normally we get a year to do this, and we've asked NHS England for quite a long time around whether this requirement would still apply to 2022. We were told in July that it does, so we've had to work quite fast with our partners to put the plan together and to do some of the consultations that we've done. And what makes this slightly different, it's considered to be a plan for how the long-term plan would be delivered for this year, 22-23, up until the end of the programme, 23-24. And of course, we're still waiting to hear what will happen for the remaining 5 years of the NHS long-term plans. And as what happens every single time is we get a set of key lines of inquiries that are produced through the national team in the NHS England. And just very briefly, these are some of the the key lines that we've had to address within the plan. These are a little bit different from the key lines of inquiry we had for previous years. So although it's a refresh plans, we've had to sort of address the key lines of inquiries to meet the requirements for NHS England. And we thought it was just helpful to just remind people of what the priorities are in the long-term plan. So it's around improving access to mental health services. And so there's targets around that in the ambitions tools. And we've got new eating disorder services, and there's a national standard around waiting times for that. And that is in fact the only service at the moment where there's national standards for waiting times. There's a program around developing mental health support teams in schools, and that program continues. I'll come on to that, what that means for our area. And then 24/7 crisis services for children and young people to be in place by the end of the program. And then there are children and young people's inpatient services, setting up provider collaboratives, and also this links with the learning disability and autism work stream, where we have trajectories around how many young people are expected to be in inpatient services. So the drive is to reduce inpatient use where possible and make sure that the young people that do really benefit from being in inpatient settings get access to those in a timely manner. And then the final one is digital, and you will be aware that there's the mental health data set, and that is being expanded, and we're now looking at new areas, flowing data around outcomes in particular, which is very exciting, so we can measure more accurately and have an evidence-based services where we can tell what difference it makes. So using that for commissioning, saying this is the investment and this is the difference it's making for children, young people with mental health problems. And just really in the context, or sorry, I'm a bit too fast. Our ambitions and what that mean for Berkshire West in practice, because it's easy to talk about strategies, but actually what people are interested in is, you know, so what difference will it make? So what we're working on is understanding better the different needs across populations. So of course Berkshire West has quite a lot of variation in what we see, and so when we do service delivery, particularly in the context of West Berkshire, we need to be aware where the pockets of deprivations are and how we direct services to meet needs that are specific to West Berkshire. And we want to, as a whole, to identify potential unwarranted variation and improve quality of care and experience and outcomes. And I think, you know, we all know that through the pandemic, we've quite a lot of pressure on our acute services. And what this strategy really sets out to do is, although we're not completely recovered, that we want to take a shift back again towards prevention and early intervention, which has always been the intention of the Children and Young People's National Mental Health Strategy. And move towards a system-wide accountability and shared outcomes, which will talk about partnerships and integration. So some of the proposed priorities, and I'll come on to at the end of the presentation a bit more detail what they look like. So we've classed them as interstrategic, operational, and co-production. And then a little bit about some of the engagement that we've done. So these are some of the key themes that have come through our engagement. So data management, we need to do more around how we use data better. Some of the key themes really is around making sure that young people end up in the right places. So no wrong door, and that they get the intervention that fits with the level of need they're presenting with. Levels and length of funding is particularly for the VCSE sector is one of the things that we're thinking about around how do we make that more sustainable. And then I think one of the key things around stronger collaboration amongst partnerships or how we work together to meet the needs for these young people. And then some of the current barriers and challenges that we've collected evidence around. So that's around having a systems response again. I think what we're still finding is that some young people get referred to multiple services, and we want to work more in partnership to make sure that we utilize the resources that we have to the best effect for children and young people. Still very clearly want to develop things in terms of timely early intervention. And again, this is where integration will form a key part. We are seeing increased demand, and that's not just in our CAM services, but we're seeing increased demand across our local authorities, our early emotional wellbeing services, our VCSC sector, our counselling organisations. So in those settings across the board, there are growing waiting lists, and those are some of the discussions that we're having together. Another key thing that I think is worth mentioning around staff wellbeing. So we do hear across the different sectors that staff are stretched and tired, and that we need to be mindful of how we also in our strategic planning thinking about staff and making sure that staff's emotional well-being is maintained and improved in the context of delivering services to children and young people. And then I think the final one on the left-hand column around holding risk and shared risk strategy. So for me, one of the things around partnerships and having a Thrive model is around how do we share some of the risk around these children and young people, and some of that would be through co-production and planning together. But then what we're going to do for the proposed priorities. So what we're looking at is a clear joined up strategy around integration and partnerships approach to defining and meeting needs of children. So what we know is the children don't fit into neat boxes, and actually they might touch different services at different points and times. We've agreed to review the CAM specification, and that we want to develop a needs-led Thrive model. So less around diagnosis, but more around this is the need that we're seeing, how as a partnership do we meet that need together. And that will have key drivers around early intervention and prevention, resilience building, resilient communities. Want to expand the partnership with the VCC sector. So we're really keen that children and young people don't get medicalised. And I think there's a bit of risk around that at the moment. We want to work towards improving sustainability for our VCC sector as part of this piece of work. And then using common language. So these are all our children. I think we're still, you know, when we have young people in crisis, it's easy to say, actually, that's your problem. But what we are working towards, and there's some really positive moves in that direction, that actually these are all our children. We need to support each other around solving problems that are really quite difficult to solve sometimes. There's a continued ambition to embed the trauma-informed approaches, and that really fits very well with the Thrive model. So really understanding, you know, why have the children got to the place they've got to, and what do we need to do that's different. So not kind of thinking, well, you've got a mental health problem, but really kind of thinking much more around the journey of the child and what needs to be different. And then I think we want to continue to work on a coordinated front door. Of course, we're working across 3 areas, and it's a complicated picture, but we want to work with partners increasingly to think about how do we ensure that the young people, when they do need support, that they get to the right places, and there's partnership agreement around that. And I think one of the new things going forward is better integration with the 0 to 5 agenda and the adults community mental health framework for that sort of transition work. And what we know at the moment that is coming through the sort of the local authority and public health agenda is 2-year-olds and readiness for school. There's some great concerns in that area, and we need to be thinking about these 2-year-olds, you know, become 5-year-olds and become older really quite quickly, scarily quickly. And so how do we work to how well are we light of foot that we can think about the emerging needs that might be heading our way, because we do know if you've got problems with reading as a young child prior to going to school, that your outcomes are much worse going forward. So much more thinking around not just mental health problems, but what are the sort of wider problems that sit around children that we can work together on improving to stop them from needing mental health support in the future. Complex young people, I'm sure you'll be aware.
I'm sorry to interrupt you. I am very conscious of time. You've got, I think, 6 more fairly busy slides.
Shall I whiz through them? I assume people have read quite a lot of them.
I think whiz through them, and we're going to be talking about CAMS in a moment. Yeah. So let's park anything about CAMS for the next section of this meeting. But if you just take on board my comment about time, thank you.
Sure. So complex young people, I think, you'll probably all be aware that there's quite a lot of work happening in that area at the moment. So we see a lot of young people ending up in some of our acute settings, and there's a whole range of projects that we're doing to divert those young people and providing better services. We want to strengthen transitioning, that 16 to 25 offer. And the mental health support teams will continue as a program. Obviously, what we're hoping is after 23-24, there's continued support from the government to roll out those teams. At the moment, we've got 50% coverage in West Berkshire, and we're hoping that that will be expanded in the future. Suicide prevention, you've already heard the presentation around. We want to make sure that is a key feature as well for children and young people. And of course, reducing waiting times continues to be a prime priority for all of us. And there's a number of different initiatives to try and improve on that one. And then again, the improving access for our inequality groups. We've seen through the pandemic how those groups have been adversely impacted by the pandemic. And I think the final bullet point is to have a more coherent link with the SEND strategy for children and young people, and how that sits across a number of our mental health and learning disability strategies. And then eating disorder services will continue to develop that program and work towards meeting the long-term plan's ambitions. Data and digital already talked about, very exciting. There's new drive towards having better data that we can improve the outcomes. Co-production, we've already made a number of different changes to co-production that's starting to have an impact. Obviously, we got a joint event with Healthwatch in the new year, which we're very excited about. But co-production going forward will be a key feature on how we will work together with partners and children and young people. This one here is just quickly the sign-off process, and then a list of abbreviations. And that's it. So
the odd NHS and that acronym, yeah, just there's just a few of them. Thank you, and thank you for listening to me about time. That was very helpful indeed. So members, conscious that we are going to pick up CAMS in a moment, so let's not raise that one. Councillor Vickers.
Yes, thank you, Chairman. Yes, obviously these two sort of overlap a bit, but a lot there, and obviously very ambitious, and obviously one does wonder about the resources, which is why the prevention side is so important. And I think what I wanted to mention here was that the importance of public awareness and raising the debate and constantly talking about how we can all be helpful and identifying when there are problems, and particularly it's parents that pick up when there are issues. And unfortunately, with the pressures of life now, people talking to each other and taking time to talk is more and more difficult. And I can remember many years ago with my health visiting colleagues actually having courses with parents to how you talk. How you talk if people have a problem, your children have a problem. And I think that's increasingly important now. And hopefully, practitioners, health visitors can be helping parents to talk to their children, and then the services they get when they do have problems, obviously that follows on from there. But with COVID and isolation, maternity isolation, the problems are going to increase, as has been mentioned here. And so this is more and more important that we support parents and help them to actually talk to their children and then make sure they've got the services when they need them.
Absolutely agree. I think resilience building, we need to have as a key feature going forward. And our public health colleagues got some very good evidence-based interventions that we use in our mental health support teams, but also in our wider work with our partners.
Councillor Doherty.
Thank you. Thank you for this. I had read it, and the strategy itself, I think, is really good. I won't mention CAMS, but I think the strategy itself, it will be around the delivery. The specific point that I actually wanted to ask a question on and pick up was you've put on there mobilise CIC offer. Now, I know that's children in care. And one of my concerns is I was at a corporate parent panel on Tuesday night, and I know that we're slipping on timings with regards to getting the initial health assessments done for our children in care. And then I see them here as well as a highlighted piece, but I don't understand what you mean by mobilise CIC. So can you, one, tell me what you mean by that, and two, give me some assurance as a corporate parent that the needs of our children in care will be prioritised by the Integrated Care Board, because certainly from the initial health assessment, some of the timings are drifting, and that is an area of concern for me.
Yes, so they're sort of two separate things. So the initial health assessment is what happens in our therapy services. So we are doing a piece of work around that. We are cited on that, and it's a risk within the ICB at the moment. So we're taking steps to address that bit.
I know I raised it because I think the two are linked, because often through those initial health assessments, we see additional mental health needs come through from those. So in my mind, the two are intrinsically linked.
Yes, from that point of view, but just in terms of the service as it stands, so the Children in Care service is a new service to provide mental health support for looked after children. So it is quite a sort of specialist service, and of course it's co-produced with yourselves and co-funded with yourselves. And we, in fact, we had a meeting yesterday. They're moving along with recruitment to the team, so that is still happening. You will be well aware, as within your own services, that recruitment is difficult at the moment, and those are some of the things that have been slowing the mobilisation down. So when I use the word mobilisation, is that we start having staff delivering services. But because of the recruitment, that is not happening as fast as ideally would have liked, but it is moving along. And I think what we can quite easily do, it would come back to the corporate parenting board to do a presentation. In fact, we discussed that yesterday, that will probably be very helpful to do, to talk specifically about that service and what difference we're hoping it will make.
Thank you, Leila. That would be really welcome, because it is concerning. So if you're coming back to as an action to the corporate parent panel, I'm more than happy with that.
And Gary.
Thanks very much, Chair. Thanks, Leila, for the way in which you've presented this. I'm particularly interested in the services around children and young people. It's very timely, actually. On Monday, we clerked the quarterly Children and Young People's Board for the voluntary sector, at which Councillor Rick Jones was present. I've got a note I'd just like to read from our clerk. Asked me to write to the council about this, actually, but so it's very timely. A member recounted conversations with GPs and schools where it was clear that no one understood exactly what provision was available to support children's mental health in West Berks. There was confusion about what was being provided by the statutory sector and what was being provided by the voluntary sector. And this particular member is a professional counsellor, and she feels out of date with what's going on in the processes. So our suggestion is, it was two things really. One is we would like to hold a meeting with health partners and local authority partners in the voluntary sector to discuss pathways, so everyone knows what the pathways are and what services are available. That's one thing we're going to be proposing. And secondly, just a date for people's diaries for the 20th of March next year. We're holding a second knowledge event, such as the one that we held at the racecourse in 2017. So we're hoping for between 80 and 100 charities to be at Shaw House, and driving in all the frontline social workers, health workers, and so on and so forth, so they actually get to know and have one-to-one chats with these people. But so that's certainly in the diary. So please do put that in your diary, because we'd like every single member of staff to be forced, driven, told, whipped into there for at least an hour or so to go and talk with organisations that are working in their particular field. But so thanks for letting me say that, Graham. But I wanted to make the point really about the pathways. That was my main point, and knowing what services. I'd be very
happy to support any event that you put together. Absolutely.
Have I described that fairly, Rick? Would you say you were at the meeting?
Yes, indeed.
Yeah. Thanks.
Thanks, Heike.
Thank you, Lalo and Chair, for the opportunity. Really a very detailed document. And just with regards to the couple of last things about data, and obviously digital is a huge form of reaching people to do good. But I just want to create awareness, as I'm sure everybody is, and it might not even be within our gift here, but more national digital security for our young people. Because just as it is a tool for doing good and reaching out, it is also an easy forum for reaching out to vulnerable people, and vulnerable. I think there's not enough security around digital. So when we raise digital as wanting more and more, can we always be mindful of securing some security features on Instagram or Twitter, Facebook? And I don't even know all the different platforms that people get onto these days, but where they find society or a place of collectiveness, it might not be a safe place. So if I could just please, in your meetings, make sure that when digital is discussed, that the fullness of that is discussed. Thank you.
Well said, I think. And Councillor Jones.
Thank you, Chair. Firstly, I'd like to compliment the report. I think it's really, very good. And as a strategy, clearly it goes as far as it can. I'd like to reinforce what Gary said in terms of information to the general public, in terms and to partners. I think the partners need to be identified and include the voluntary sector partners as well. But I think it's vital for parents and carers particularly to understand the pathway through the various organisations that can help. I think everyone understands there's lots of them. I don't think anyone understands where to start in the system and how to proceed through it. So that's vital, I think. Secondly, I would like to see a mention of schools, the role of schools in this, because I think that's really important, and I see no reference to that at all anywhere.
I think when I talk about partners, I would include education in that. So I think absolutely, when you talk about children's well-being, it's essential that children are at school. We know that the best outcomes is when children are engaged in education and they're in the right places. So, you know, from my perspective, that is very much part of the strategy. School is where children spend most of their time in terms of hours. So that's why the MHSTs are so important, and we're really keen that the government continues to invest in that area. If we're able to expand beyond 50% of schools being covered, we think we would have a really, really good preventative offer, working together with our public health services around school health nurses and early help within the local authorities. So absolutely, education is key, and what we've started doing is having more steering group, multi-agency steering group for some of our new projects that are coming online, and education is a key partner in that. There is, in fact, a new service that will come into this area from April next year for complex young people, and our education partners across Bob are invited to sit on the steering group for that, because education, you know, as far as I'm concerned, you have health, you have the VCC sector, you have the children's services, but education is critical, I think, to improving the long-term outcomes for children.
Thank you.
Thank you, Belinda.
Thank you, Chair.
Thank you, Chair. Sorry, apologies.
Thank you. Technical issues there. Really helpful overview. Thank you, Leila, for that presentation. I just wanted to pick up on something that Dr. Veltman mentioned, and also Councillor Jones, around data and education. And I think there's something about the role of public health here in terms of surveillance as well with children and schools. So how can we start to pick up where there are issues within schools with either attainment changes, drastic changes in either attainment or in attendance, and how can we use that data to actually take more of a preventative approach with some of the strategies that we're considering implementing. And that might be something for the future if we don't have that framework, but it could be very helpful for us to have that level of intelligence and start to act on the intelligence as well. Thank you.
Yeah, no, I think you're quite right, Belinda. Ideally, what I would like to see happen, I think this is probably a future piece of work, is how we use some of the evidence that's coming out through our school health nurses, public health service, in terms of needs within particular schools, how we link that with our strategy, our MHSTs, and then how we link that more widely with our early help services, absolutely in our education. So we'll have data for every single school around who's on roll, who's on reduced timetables, and certainly the ambitions for the MHSTs is to start targeting much more with our local authority colleagues of children who are struggling to maintain the timetable, who are at risk of not going to school, and we'll be thinking more widely around the kids that aren't at school. One of the things that happened in the pandemic is that whole waves of children with quite complex needs started being home educated. So I know that local authorities are working on that particular issue, because the best place for children tends to be at school, where we've got a number of adults also seeing children every day. So I think you'll probably be aware, Belinda, that a number of young people who needed refeeding in our acute settings. And one of the reasons why they came to light very late in the day was that they weren't at school. So there was nobody saying, oh, you look like you lost a lot of weight. And so it's part of that sort of wider safeguarding. And that's why being in education is really very important.
Thank you. I think a useful, very useful debate, a very useful paper, and we are asked to vote on this item. So members, you are asked to agree the proposed priorities that are at 3.3 of the pack, strategic, operational and co-production. I am going to conduct a virtual indicative vote of those outside the chamber and physical hands vote together of those inside the chamber before I go to the formal vote. So members of the Health and Wellbeing Board, please vote either using your Zoom hand if you are outside the chamber, or physical hand if you're inside, whether you approve the proposed priorities. Thank you. I think that's a yay from the generality. Thank you, everyone. So now, members in the chamber, please vote in favour if you wish to. And Andrew abstaining, of course. Thank you. That's unanimous, apart from Andrew, who will always abstain, and I recognise that. So we move on. Thank you for that. We move on to CAMS and the ICS response to the Health Watch report, and I'm going to ask Nikki Cartwright to speak to this. Nikki. muted at the moment. It's not happening, Nikki. There we go. Okay, we can hear you.
Good morning, everyone. Apologies for the little technical interruption, and thank you, Chair, for the introduction. And I think it's really helpful that we're considering the update on the CAMS report following the presentation by Rob earlier on today, where you would have had a snapshot around the work that has been undertaken in the Live Well strategic priorities. And hopefully we'll see a reflection all the way through the work that we're doing of those priorities as we develop them. And also the presentation that Layla has just done on the children and young people's mental health plan. I think it's useful to remind ourselves that I think it was December last year when we first discussed the Health Watch report. And we've been able to work with Andrew and the Health Watch colleagues to develop the recommendations. And I am going to assume that everyone has read the report. I think the point I would like to make is one of the recommendations in the report is around outcomes and the importance of outcomes. And you'll start to see, you would have heard Lila talk about those outcomes in her presentation. And that needs to be our focus going forward, is what are the outcomes that children and young people and their parents and carers are expecting from our service, and then how are we actually delivering those outcomes with our interventions and offers. So I think I'll sort of just take questions, and Lila is also here, and we'll hopefully between us we'll be able to have a very fruitful debate, and Andrew's here as well, and we worked together to make sure the response was appropriate.
Indeed, and I'm going to start by apologising for Lila for not knowing how to pronounce her.
It's as in Delilah. That's how you remember it.
So, members, virtual and physical, do you have questions you want to raise? I see no one itching to speak. Councillor Vickers.
I think I was expecting Andrew to talk here, but maybe he's going to sort of be responding to questions or commenting later. Yeah, I think it's obviously a very timely report, and good that it's here in conjunction with the previous one. And very worrying, actually. I mean, one specific question I had was sort of in the summary about why we have such a high rate of young people who are self-harming in this particular area. You know, has that been looked into, and why do people think that's the case? And obviously there's the general question in 4.2 of staff shortages, and you know, how do we actually address that? And does anybody want to say anything more about that? Because we're not suddenly going to increase our staff, and yet we hope to improve the outcomes.
Who wants to respond?
I can definitely respond to the workforce. I don't know if Lila can respond to the self-harm rates, or if that's something we need to take away.
I think in terms of self-harm rate, obviously we work with public health around self-harm and the suicide plan. I think what we've discovered is that sometimes we think about mental health for more deprived areas, but for self-harm, that's not necessarily how it presents itself. So you can have quite wealthy areas where you also see self-harm, and there's different reasons for that. I think some of the stuff that came out through the pandemic was around loneliness of young people, feeling very isolated, and anecdotally, because this is quite hard to measure in surveys, there's a bit around young people finding themselves in families where the normal support structures, they saw their own parents struggle in the pandemic, so they felt even more isolated than they had been previously, and all the support that you would get through being at school, through education, going out, you know, playing football, all the sports activities for quite a long period of time, we're all stood down. So I think the impact of pandemic, you know, has had a very wide impact on children and young people. just in terms of self-harm and the suicide work that we will be working with our public health colleagues around what we can put in place through our MHSTs, but also I think more widely, and this is why I put that down as a priority actually. So it's not, for me, it's not just suicide, because we know that if you self-harm, there's a greater risk of going on to attempting to take your own life. Is how do we use the data much better that we have, so we start having more targeted interventions in areas where we see clusters of self-harm and suicide attempts.
Thank you. Yeah, Nikki, did you want to just pick up on?
Yes, and Councillor Vickers is absolutely right about the workforce challenges that we face. We see that across West Berks, Berkshire West, and then Buckinghamshire and Oxfordshire. However, we do have a ray of light in that we've been successful in receiving funding from our NHS regional team to pilot a CAMS Academy. It might be helpful if I just send in some information to Gordon to share after following the meeting. But we are looking at a number of ways in which we can take people as soon as they've finished training, bring them into our services, grow them, and help them advance in their careers much more quickly. And there's a number of other sort of tools and ways in which we're looking at increasing that workforce, but absolutely recognising the pressures that we have with our staffing, and then how that then impacts on children and young people. But the CAMS Academy is exciting, but it's going to take time for that to work through. So it's not a quick fix. We have. If I think about the investment that we made in the children and young people's neurodiversity service about 18 months ago, it's taken sort of 12 months to be able to recruit almost to full establishment. But BHFT or Berkshire Healthcare Foundation Trust has been very innovative in the way in which they've addressed that recruitment challenge. So it is possible. But it takes time, and it takes creative and innovative thinking.
Thanks. Councillor Doherty.
Thank you, and thank you for the report. I was pleased to hear about the CAMS Academy, because actually the situation and the waiting list for CAMS was pre-COVID. We need to recognise that this wasn't just a situation that COVID has exacerbated, but waiting list times were not appropriate before COVID. So I'm really pleased that now something is going to be done around that. And I'm quite interested about how we tackle, I completely recognise the national shortages and how we particularly tackle them here in the south with some of the issues around cost of living and getting people into the area and everything else. So I think that's a really welcome initiative. So thank you for that. My focus and question really comes to 4.6. So there's a recommendation there around improving communications between CAMS teams and parents and guardians. And you touch on the long-term plan investment. For me, this has always been an area of challenge, and I'm not quite convinced that does it for me, in the fact that the biggest concern that parents have, and that we need to unpick this and we need to break it down, is that they want to get that assessment, and in fact they want to get that in some ways label, and I'll call it that, because they believe that it opens access to other services. And I think there's a piece around communication here around actually you don't need that to access other services. And this is what we need to do, all of us, in terms of communication, is break down this barrier in people's mind that you have to have that assessment to get help. And I think there's a huge piece of work, and I'd like to see a lot more around the communication piece with parents and guardians, because for me, having worked on frontline services with those parents and guardians, having sat through this board, talking children and young people for how many, nearly 8 years now, this has been something that we've never cracked, and we've never been able to get across. Sally and I used to work really closely trying to say, actually, all those services are there, all that stuff is there, but it's not getting that message across to parents and guardians at that early stage. And so for me, the long-term plan investment doesn't really fulfill that particular recommendation. I think the rest of it is good, but that was the one that I've probably got the most concern about.
Thank you. Lila, do you want to respond to that, or shall we take that away and come back? I don't want to put, I'm sorry, I'm kind of putting you on the spot a little bit, but I think it's a, thank you, Councillor Doherty, it's a point well made.
I think I would quite like to respond, because the NHS is forever complicated, and the autism diagnosis and the neurodevelopment work doesn't sit in CAMHS. So I think we need to be really clear that we're talking about autism diagnosis. That's a different pathway, and that piece sits in the learning disability and autism work stream, but we are obviously more and more co-working that piece. I just want to come back to the communication. So I think you're absolutely right, and the report is right. We need to be better communicating with families, with parents. And for me, that it would be part of some of the redesign within CAMHS, part of that project we're about to undertake. So that will be through co-production. So in one of the key worker pilots, parents are helping us around producing the information for the service and how we should communicate with parents. And I see that as part of the new world, and actually parents help us to say what is it that they want in terms of communication, and then help us design that communication, as well as young people. So that will be some of the new things that will come out of the transformation of the CAMHS service. I think in terms of the autism and ordinarily available, there's clearly a piece of work that needs to be undertaken, and that will be in co-production with the local authorities around how do we support those families to think actually this should be needs-led, it's not diagnostic-led. And I think Nicky would say in the learning disability and autism strategy, that will be one of the key themes that will be coming out.
Can I just come back on that? I wasn't specifically around the autism pathway, although you mentioned it, and I entirely agree with your thoughts around that. What you just said isn't in this report. So the fact that you've just identified that there's a piece of work around co-production about how best to communicate with parents, the response to this report doesn't say that. So in my mind, we need to be absolutely clear on what will be done, so that if it isn't done in a year's time, we can come back and go, well, actually, as a health and wellbeing board, we all signed up to this and said this was the right response, but it needs to be in the report.
Yeah, well, I'm sure we can make an adjustment to that.
Absolutely, pick that up.
Yeah, let's not forget that we are noting the report rather than voting on a series of things to happen. But certainly, I think we take the point that we want to see that embedded. Now, I'm just going to look to Andrew. You indicated you wanted to speak, but shall I leave you to the end, Andrew? Yeah, fine. Councillor Stewart.
I don't want to delay it, but I think it's important that that point has just been raised about communication, and actually I think that links into now. I'm concerned. 4.3 initiate an internal review as to why parents and guardians of young people do not believe when they've been to CAMHS that it's made any difference, and I do wonder if that is linked to CAMHS. If you talk to a parent where they are struggling with their child, CAMHS is the golden bullet. I need to get to CAMHS. I've got to wait 3 years to get to CAMHS, whatever it is. And I think Councillor Doherty absolutely right. There is other health out there, other help out there, and it all just seems to be about CAMHS. And I don't have a great deal of experience with the Thrive model, but I'm pleased to see that the recommendation says about aligning CAMHS and the specification with the Thrive model, because that seems to make a lot more sense to me, actually, that CAMHS seems to be about the individual, but Thrive is it can be about the whole school, it can be about the community. And actually that delivers so many more benefits than just CAMHS in isolation. So I just want to make that point.
Let's go to Gary.
Yeah, yes, Lynn articulated it very well, really, about the comms, and I think that reflects also the meeting that took place on Monday with the Children and Young Peoples. And we've got the Special Educational Needs Board coming in January, and I'm sure they're going to be saying a very similar thing. So, given the appetite for this, can we sort of formally propose some sort of summit about pathways for frontline workers, voluntary sector frontline operators, so we all know what's going on. That's a proposal. Not quite sure who's going to lead on it, but I'm happy to lead on it for the voluntary sector to get them there.
Well, let me leave you to have those discussions.
Okay.
With whoever, with Lila and Nikki and anyone else who needs and anyone who needs to be involved in that conversation, and then we wait to hear, I guess, is the best I'm going to put on that one. Andrew.
Thank you, Chair, and thank you, Nikki and Lila. There's sort of 3 years work in this, and actually, as Councillor Doherty said, there's so much more. Whenever we've been talking about CAMS and whenever it's been covered in the media, it's always felt like a system of woe and everyone knowing there's a huge problem, and whether it's our 1001 days priorities or issues of children in care, we could talk for hours just about this. But I did actually want to concentrate a little bit on some chinks of light here, and I think this really represents it. I want to absolutely commend Nikki and Lila about the fact this is a Bob ICS response at the Health and Wellbeing Board, and it's in detail, it's in depth, it's taking local West Berkshire problems. It's the first time I've ever seen one. It may not be the case, but I can only commend the approach to saying here is a set of local problems. What does the system think in its operation it can do? And I think this is a pretty good stab at responding to what was the parents' reactions, concerns, which are not always logical. As Councillor Stewart said, there is this utter belief that CAMS is this golden bullet that not only once I get there, this raft of services will open up, but actually more importantly for parents and guardians and carers who've dealt with really troubled children, they feel if only I get there, my child will be cured. It's a little bit like the sort of magic surgery that people expect. The minute I go into hospital, my knee operation will turn me into Usain Bolt. It's very, very similar, and parents are desperate. And I think I kind of want to take a little bit of the pressure off the NHS here and actually throw it onto the Health and Wellbeing Board on this, because this is not a health only problem. This is a system problem. So although the NHS and the Mental Health Board element of it have taken this upon themselves to respond, I think, again, we've got to think about how do we assess this? Do we just wait for kind of looking at numbers on boards? Do we wait for another crisis? Do we wait for another terrible incident somewhere that involves a child's mental health locally? Or do we actually genuinely start to holistically manage this? So there's a couple of things I just wanted to touch on. I'm still concerned how primary care responds and gets involved in the whole process, because CAMS is somewhere down the level. People tend to go to the GP to start with, and then on they go. Medicalisation often follows, the standardised sort of can't do anything, but here's some drugs. And I wonder whether both the NHS, the local authority and public health need a slightly more radical approach, which I think we could do in West Berkshire. And one of the things we could do is potentially put this sort of issue through the Better Care Fund and through the Locality Integration Board, because some of it's going to need a little bit of funding, and it is absolutely a joint programme. We're talking about additional workers in primary care to deal with mental health, to deal with other issues. Well, why aren't we talking about additional workers to deal with children's mental health and family issues, family breakdowns? Why do they have to only be what NHS England says? They don't. And the funding could come from potentially pots like BCF, because I think we've got to start joining this up. Councillor Doherty said these services are here. They absolutely are. What we're failing to do is join them up coherently all the time. And then we're failing to communicate with the parents. So the other quick point I wanted to make on this is that this is a fabulous way of actually taking patient and public voice, delivering it here, delivering it to the ICS, getting it responded to, hopefully getting some things changed, but equally it's just being discussed. And there seems to be a little bit of sort of, well, the minute we're an outlier, we'll discuss it. Well, heck, our strategies now align, which is fantastic. The whole discussion this morning aligns with this, which I think is to be commended. And it feels like it's been done deliberately, but I think it was just how because things do join up, things do overlap, they are messy. And the parents and public who are depending on the system to help them don't want to know that doesn't sit with this department or this pathway. They want to say help, talk to each other, join things up so that the education folks talk to primary care and things like this. So I'm absolutely delighted it's come back. I'm delighted the Health and Wellbeing Board have come back a year later and said what's going on. And I think whether it's through Health Watch, whether it's through the VCSE, we need to open these pathways up of taking public and patient feedback and saying, here's what we think is going on, here's our challenges. Some are rational, some are not, and letting the system come back and react. I think it's a fabulous, fabulous way to do things. And again, wouldn't it be great if we revisited all of this in 12, 18 months and asked the same questions and said, of all these changes proposed, are they working? Every time a new pathway, a new service is input, please, 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 please put some budget in for CAMS, because you have to tell people within the system and the public what's going on, what's the changes, what are we meant to do. The CAMS Academy, what a brilliant idea. How are the public going to find out about it? And it really feels like a positive step, as I said, rather than I've had so long of sort of negativity. So well done, ICS. Well done, Health and Wellbeing Board, for discussing this. And let's keep this process of review, bringing back feedback and actually seeing if things can be done locally, and rather than just going, oh, it's NHS England or it's the government. That doesn't help us locally. We need to be able to do things locally. Thank you.
Thank you. Lila.
Thank you for your words, Andrew. And that is exactly where we need to be heading. So for me, when we talk about a Thrive model, it is exactly what you described. And I think if we could frame things in terms of building resilience, so building resilient communities, building resilience within children and young people, that is something that we all have a role to play, whether that's at ICB level or whether it's a local level. So I think there's quite a lot of stuff we could do around building resilience. And I know that public health have got some amazing evidence-based interventions around building resilience. We've got the whole school approach in schools. So we're not starting from nowhere. There's quite a lot of stuff that we collectively could do as part of our sort of strategic response.
Thanks both.
Sorry, I've just got one point of clarification on the communication point. I think that might be slightly our fault in terms of, because I think we had offered to try and put a slide in about the Thinking Together event for children and young people, which has been discussed in the previous papers. So I think that's part of this process of improving communication. So apologies for that not getting to the report.
Noted. Members, you are simply noting the paper. I think it is noted. Now we move on to actually one of the more important things, not that any of this stuff isn't important, but BCF, Better Care Fund, is a core responsibility of the Health and Wellbeing Board, and there's a fair amount of money involved. On the other hand, we are now running half an hour behind time here. So, Paul, firstly, I think everyone should have read, to the extent they want to read, the detail, and there's great detail in here. And I want to, through you, thank Maria Shepherd for the amount of work that goes every year that goes into this beast. It is a beast, but there's a lot of money involved, and we need to spend it wisely. And I'd just like you to very briefly refer to this, and also maybe to the discussions we've had very recently, indeed, yesterday, about the discharge money that has just come through the system.
Thank you, Chair. Yeah, as you say, lots of detailed work here. There's been lots of engagement with partners. This comes today with my full, my full confidence. Lots of continuity. very sensible, and some space for innovation as well. So certainly would welcome sign off today. The second element that you refer to, 1.18. Is it too far away? Okay, I'll lean in. Yeah, okay. So the £1.18 million is the quantum relating to the winter discharge fund for West Berkshire. That is the system looking after people living in West Berkshire. As you say, we spoke yesterday. The submission deadline is extremely tight for this one. 16th of December, we need to get plans sent off. And we are talking actively with, as you'd expect, the acute settings locally and reps from Bob. But fundamentally, I think the key piece here is that we need to get this signed off. And that my proposal, therefore, today is that this board delegates that decision as an individual decision to you, so that we can turn this around. The plan was received extremely recently. The conversations are brisk. And we have a ticking clock. So as I say, I think if this board is comfortable, the best way to approach this is that you have a delegated decision to act on its behalf in terms of the sign off of the final plan.
So I'll come back to those proposals in a moment, but I'll look for anyone who has any questions or issues with relating to BCF. Excellent. Nobody appears to. We are being asked to do two things. One is to agree the Better Care Fund plan paper you have before you with all that detail. Secondly, you are asked to delegate to me as chairman of the Health and Wellbeing Board authority to sign off a second BCF paper, which has been drafted. There's a little bit of tweaking to be done following our discussions, but basically takes the discharge money that has either come direct to the council or has come to the council through the integrated care system and has been devolved down through the system to the council, totaling somewhere over £1 million to be spent on hospital discharge functions. And most of that money will be spent on domiciliary care for those coming out of hospital, to get them out of hospital, to free up space within hospital. And I certainly, a lot of work's been done on that, and we've had some discussions about the precise numbers, and I can assure you that plan also looks pretty good, but we just haven't had time to put it in front of you in order to get that formal sign off here. So you're delegating to me. So I'm going to look for indicative vote of everybody, hands in the room and virtual hands abroad, as it were, to agree those two items. Thank you. Thank you. And now, noting the positive viewpoint, look to members in the room for a vote. I will formally propose. I'll look to Paul to formally second. Thank you. Members in favour. I'm going to abstain since I'm going to be given delegated authority. Thank you. And Andrew and I abstaining deliberately on that one. Right. Thank you, members. Let's dash forward. Now, you have a presentation in the pack on cost of living. Members will have already seen some of this stuff. I certainly have. So I'm not going to ask Sean to present the slides, but I am asking him to have a very, very brief overview of where we are and then questions, but please keep it brief. Sean.
Thank you, Chairman. So the last time I was at the board, I brought forward a paper that described what we were going to do in the coming weeks. I'm pleased to report to board that we have made some progress on this issue. So since the last meeting, we've had two meetings with the voluntary sector back on the 14th and 17th of October, which has allowed us to scope the response locally. We've formed a kind of core group, really, which consists of the council, the volunteer centre and Green and Common Trust to oversee the activities in this area. And I suppose really the biggest step forward was on the 24th of October. The council, in conjunction with its partners, launched the cost of living support hub. So that's now been up and running for about 5 weeks, a little more. To support all of this, we have a couple of working groups. So internally within the council, there is a group chaired by Steve Welsh, who's on the board, looking at the response of the individual departments within the council, and then there is effectively a working group that looks at what's coming into the hub, what further work we can do in terms of provision, signposting, etc. Sitting alongside that, there has been a huge amount of work in relation to community engagement more generally, and communications, and a whole suite of communication. Well, there's a communication toolkit being produced, and a whole suite of communications and community engagement projects are underway. That has included a leaflet drop to every house in the district, but also things like targeted leaflet poster distribution through voluntary sectors, GPs, libraries, churches, etc. We have now basically started to develop and roll out the outreach part of the cost of living hub service that we've put together, and that ties in very much with the Be Well This Winter programme that has been developed by the public health team and partners for West Berkshire. Looking ahead, really, just a bit more kind of, obviously the things that we're really taking note of are demands on the hub. We have seen an increase in demand on the hub more recently. The implications basically in terms of demand for the voluntary sector, and we had a meeting, the leader and I had a meeting this week on that subject, and it seems at the moment we're fine, but we're very definitely keeping an eye on that. But also, what are the implications going to be of things like a cold, long winter basically period? And clearly, obviously, the temperatures change. Everybody on the board will know that the temperatures changed this week. We're tying up very much with some of the work that's going on in the area of mental health, and obviously we've had I myself have had a conversation with Adrian and with Councillor Stewart, and obviously about how that ties into the work that's going on that's set out in item 17 on the agenda today. And then beyond that, really, obviously we're looking towards the Health and Wellbeing Conference, which is going to feature some of the work that's been going on and some of the findings, which is the next item on the agenda. So I think I'll stop there. There's a lot more detail in the slides, Chair, but I'm happy to answer any questions.
Thanks for the brevity. Councillor Masters.
Thank you, Chairman, and thank you, Sean. Yeah, thank you for the report and the work that you and your team are doing. I know many members have been involved and having conversations with you and your team and everybody who's reaching out across the district. So in terms of communication, we often talk about the need to communicate more. I've had feedback from a number of residents across the district that they got duplications of the leaflet that went out to every household. So I don't know whether that was a postal issue or whether there was some mix up in the directive to the post office and whoever was contracted to do that. So there may have been some duplication of delivery and obviously the waste of resource there. So that might be something to tie on. But no, I think along with this item and item 17, I think we're as a council, we're trying to get a grip on a very serious issue. So thank you very much.
Thank you. Yeah, I'll take back the issue about the duplicates. Obviously, clearly that wouldn't be what we commissioned, but I'll take that point back. Thank you.
Councillor Vickers.
Thank you. Thank you for the effort that's been made to get the information out there on the leaflet, door-to-door leaflet, which I'm sure will be been very valuable. Just one sort of point or a couple of little points. Warm spaces, which is, which Councillor Masters here has helped to sort of develop in the area. I note that on the web page, there are no specific mentions of where these warm spaces are, and I just thought that would be useful. St Nicholas Church has just started running their hall, and they're getting very few people turning up, and they just don't think that people know that there is a warm space there. I mean, in this cold weather, hopefully, people people will find out more about them, they will use them, because obviously it's really important that what's out there is used by people and that they can stay warm and stay safe, and that's elder people and families. And the other thing, I mean, there's been something in the press about problems with vulnerable households who have prepayment systems, repayment meters, that there are vouchers available that people are not receiving. And this is quite worrying, what I read. And I wonder whether we have an awareness of this, whether there's any way the council can get the message across about these vouchers, make sure that the vulnerable households are receiving them. You know, because this could be a matter of life and death for some households, that they can't keep themselves warm because they don't have the vouchers in order to sort of get the heat that they want. So I just wondered whether anyone has a comment on that.
Can I just pick up on the first point on warm spaces? We have actually called out for details of where these warm spaces are being set up, Councillor Vickers, and we have mapped them. And Reece in Steve Welsh's team has done a very good job at mapping that now. So I think probably the thing I need to take away is to have a look at whether basically it's obvious enough in terms of the website and the other mapping basically for the public to access that. So we will go and have a look at that point. On the second point, I don't. It's not something that I've seen come into the hub questions about these vouchers, so I really can't kind of comment on that. But I mean, certainly queries about or referrals about energy costs are certainly something that is coming into the hub. But I'll take that point away as well and speak to the hub manager about basically whether there's anything we could do to advise on that.
Councillor Masters. Thank you, Chairman. Just to on both those items, as Sean mentioned, Reece is coordinating, and there is an ADODL map with services on a global level around the district. But Reece is actually putting together a layer that has a dedicated URL. And once he has all the information, I'm assured that will be distributed to everybody and through the normal communication channels, and hopefully be prominent on the website. And on the other issue about the vouchers, there has been reports in the national media about the lack of take up, about 50% nationally, I believe, and it is an issue around the prepaid meters. So there may be some communication and insight required towards that on the local community. And apparently if people are cancelling direct debits because they think and they have smart meters, there is some confusion as to whether they've been put on a prepaid, so there's a lot of confusion around what people are entitled to.
And thank you for that. Dr. Veltman.
Thank you, Chair, and I'd also like to thank the team and the speed at which this report and all the activity has come about, because, we're in another cold snap now, and it's the beginning of the cold snap. And I believe that there's lots of communication from a health perspective also going out, just the correlation, making the correlation of keeping warm and keeping your long-term conditions well controlled. There's a direct correlation. So I find this very timely to support our most vulnerable patients or people, and it's going to be tied in with the health cold messages going up there. So I think it's really timely, and I thank everyone involved.
Thank you for that. Steve.
How's that?
He's new.
Thank you. Just to that point, we did balance very carefully with the cold weather response, that balance between the advice and the pressure that people are going to be under in relation to cold homes against the guidance in terms of the health and wellbeing. So I think we've struck that balance quite well. And I think what we've seen, which is really positive, is actually really starting to link those two things together around the cost of living and the health and well-being of our communities.
Thank you all, and thank you, Sean, for the work that's going in and the team. We're asked simply to note there's no vote required on this, as indeed, even though the paper says at item 14, we're asked to approve, consider and approve. Actually, I'm going to suggest you change the word approve to note in your minds in relation to the Health and Wellbeing Conference, and linked into this, the district parish conference, because we propose to run those in tandem. Well, we don't just propose to do it, we're going to do it. I can assure you. A lot of work has gone to get to this point. Zakia is available, but I don't think I'm going to ask you to speak to this paper, Zakia. Don't think it's necessary. The paper tells you what you need to know. Book the 31st of January in your diaries. The Health and Wellbeing Conference, I think, is due to be on during the afternoon in a hybrid format. So you will be very welcome to come into Market Street, come in here. It won't be looking quite like this, or to zoom in. And then we will run into the district parish conference in the evening, but hopefully there'll be some overlap, because I think there will be some parish councillors who will be interested in what goes on in the morning and in the afternoon, and so on and so forth. And we'll also be having a lot of other stuff going on around from various services. But please simply note everything in that paper and make sure that date is in your diary. Next, members, I'm going to take you to another Zakia item, which is something that members may wish to consider. And here, again, we're not asked to vote on it, but Zakia, do you just want to talk to where we are with strategy delivery?
Yes, and so this is the second quarter which has been reported on. I would say that those who are owners of actions, it's really been helpful for us and them to focus their minds on these quarterly updates. What it's allowed is for people to critically engage with the actions. Members will note that the delivery plan, which was produced by the previous acting consultant, after the last conference in January 2022, identified key actions for partners as well as council to deliver on. What we are identifying is that there has been some wording change, which I think is appropriate given that the critical lens has been used. Just tying into the conference, I think the conference and the potential outputs from the conference, I think, is also a chance to review and reflect on whether the delivery plan actions actually reflect what is current state. So one of the proposals I do have is that we do use the outputs from the conference to really inform, to make sure that our priorities within the strategy are relevant to the current situations that we are living, particularly with the cost of living being such an important element to this. Other than that, I would say that feedback is being received. You will see it's in a paper format because we're not yet ready to use the system that is due to be in place in the council. And unfortunately, I won't be here to see that through, but I will make sure that that's put into action as soon as possible. Thank you.
And I will say a couple of things. Firstly, Zakia, thank you for the amount of work you've put into this and into the delivery plan. I think it's a sterling piece of work, and obviously a work in progress, a working document. And indeed, I had a conversation with officers, Kathleen particularly, about the new system last week, and I am assured that we are high on the list.
Yes, we are.
Using the new system and embedding this so that it will be easily available, and individual people can update their individual things, so we'll all know what's going on and there's no lag in getting in understanding where we are in terms of the delivery plan.
Yeah, and I would like to reinforce that officers have been really positive about sending in their updates, and that includes to our partners in health as well as to the voluntary sector as well. So it feels like it's been a really positive process.
For partners in health, the intention is that they will have logins
restricted logins, but their login will allow them into the bits of the system they need to get into in order to do their own updates. Yes. So they don't have to provide it to the centre and then the centre has to input. It will all be, in that sense, seamless by people actually targeting the bits they're responsible for, which is a good move. So no need for a vote there. We now move on to 3 items which are not for discussion, but for you to have read and noted the reports. The first one is the ever-giving saga of continuing healthcare and the conversations, but everything I hear is that it is positive. There is positive movement in relation to continuing healthcare and Bob. Next is Adrian is here available to answer, so we can have questions if you want on the financial problems and mental health paper, which is again a comprehensive piece of work. And I simply say, if anyone, Councillor Stewart, has a question, let's hear it.
I shouldn't have a question really, should I? I don't. I just want to thank Adrian actually as he's here, because he's been a driving force behind this. Also Rachel Johnson, between the two of them, I just rock up to whatever they organise, and I'm really impressed with the way that the structure on a very thorny subject, one that you almost think, how on earth can you get your arms around this? And they've come up with some really practical ways of having discussions with our other partners in the district. And I think when we get the final report in February, I think we'll have some good practical delivery plan that will come from that. So thank you, Adrian.
And Councillor Masters.
Yeah, it's just more of an observation and a thank you to Adrian and everybody who's been involved in putting this together. I got a look at it some weeks ago as part of the warm spaces discussion that we initiated, and it's been very well received by partners and the charities who are involved and the groups involved. So yeah, I think it's very welcome and very pertinent. So thank you, Adrian and Rachel Johnson.
Thank you for that. And Councillor Vickers.
Thank you. Yes, it's a very, very detailed report, and it's quite convoluted, because which comes first, your mental health issue or your financial problem, or it's sort of very, but it's very informative. My usual comment is that obviously people need help and advice and support in the early stages, and hopefully we'll have enough people trained and able to go out to again where people meet, where vulnerable people meet, to actually have a one-stop shop for people who are having issues, that they can have the advice and the support and the signposting as soon as they need it. And they need a conversation to know what's out there and, you know, and where they can get help. So it's just so important that people have access to help as early as possible, and there's enough people out there to give them the help and support in the places where they are.
Thank you. No one else? Thank you. So I will also add my thanks to Adrian for the work that's gone into this. Thanks, Adrian. Very useful report, and look forward to seeing where we are in February when you bring back the next iteration. Members, we now move purely for information. You've got the updates to the Constitution, which members discussed way back, and indeed had a sort of a brief reference to at the last council meeting. What I will tell you is that work is ongoing in relation to similar documents in relation to each of the sub-bodies of this board. Some are already drafted, some are in draft. And we're working through that with the steering group. So there should be a comprehensive set of what are effectively terms of reference for all of the bodies within Health and Wellbeing Board. So we now move to members' questions. Gordon, I don't think there are any.
No questions received.
Thank you. And we then move to item 20, the forward plan. So I look to anyone who has anything to raise in respect of the forward plan? I see no one itching to speak. Rick, apologies, Rick. Councillor, I should be Chairman, Councillor Jones. I should be far more formal, shouldn't I?
Not at all. Given that we have the conference at the end of January, is it worth having any sort of feedback from that or report from that in the February meeting?
Not a bad idea at all. We'll add it to the list. Gordon has made a note. Thank you. Anyone else? No, excellent. So, future meeting date. I do apologise, Councillor Masters.
As we've deferred the asylum seekers report from Health Watch, Andrew's due to present it. Obviously, Andrew moving on. Do we need to work out with the new incumbents, etc.? Who's going to be presenting?
Well, that I think is a matter for Health Watch. We wait because of course one of the items we looked at earlier on the agenda was membership of the board, and Health Watch are a statutory member of the board, and therefore we have to have someone from Health Watch in the room, as it were. So over to Andrew for a comment.
Thanks, Chair. We already have a replacement lined up, a lady called Fiona Warby, and then the intention also was to co-present it with our voluntary sector partners, if possible, who are in their daily can really give some meat to any questions or whatever. So I can liaise with Gordon about who they are and where they are, but I think having them in there as well as us, we've kind of brought the report together, but it's really rich from people who are in the accommodation on a weekly basis and can really give the board the background. So I think it would be worth ensuring they can co-present with Fiona.
Hear that. Clearly the steering group is the body that considers the agenda for Health and Wellbeing Board meetings. So we'll make sure that that is picked up at the steering group, which is in the cycle of process to look at the report in any event. So Gordon will have made a note, and obviously the other thing we do need to make sure is that the membership is reflected with, thank you for that information, but we need to make sure that the membership list is updated, and then technically we'll need to vote on it at the next meeting, because you can argue that it goes with the role and whatever, but I think it's always good to just dot I's and cross T's on these things. So members, those items, and no one else having stuck their hand up, you have the dates of the next meetings in your pack. So I am going to conclude by once again saying thank you to Zakia for her efforts, and particular thanks to Andrew for his efforts, and wish you all felicitations of the season and of the new year for those who I don't see between now and January. Please remain on screen until we've closed the meeting.